Neet PG Grand Test Set 5 Questions 101 to 125. Question 101. A patient presents with hyperpigmentation, hypotension, and weight loss. Serum cortisol is low and ACTH is high. Most likely diagnosis: A. Cushing's syndrome. B. Primary adrenal insufficiency. C. Secondary adrenal insufficiency. D. Pheochromocytoma. Answer: B. Primary adrenal insufficiency. Explanation: primary adrenal insufficiency Addison's disease causes decreased cortisol and aldosterone with compensatory increase in ACTH, leading to hyperpigmentation. Question 102. A middle-aged woman presents with easy fatigability and bone pain. Lab shows hypercalcemia, hypophosphatemia, and elevated parathyroid hormone. Most likely diagnosis: A. Primary hyperparathyroidism. B. Secondary hyperparathyroidism. C. Tertiary hyperparathyroidism. D. Pseudohypoparathyroidism. Answer: A. Primary hyperparathyroidism. Explanation: primary hyperparathyroidism, usually due to parathyroid adenoma, causes excess PTH secretion leading to hypercalcemia, low phosphate, and bone resorption. Question 103. In acute myocardial infarction, which cardiac marker rises first? A. B. Myoglobin. C. Troponin I. D. LDH. Answer: B. Myoglobin. Explanation: myoglobin rises within 1 to 3 hours of myocardial injury, but lacks specificity. Troponins are more specific but rise slightly later. Question 104. Which is the drug of choice for treating cluster headaches? A. Oral sumatriptan. B. High-flow oxygen. C. Propanolol. D. Ibuprofen. Answer: B. High-flow oxygen. Explanation: cluster headaches respond rapidly to high-flow inhaled oxygen and subcutaneous sumatriptan. Oxygen is often preferred for immediate relief. Question 105. A newborn develops jaundice within the first 24 hours of life. The most likely cause is: A. Breast milk jaundice. B. Physiological jaundice. C. Hemolytic disease of the newborn. D. Crigler-Najjar syndrome. Answer: C. Hemolytic disease of the newborn. Explanation: jaundice in the first day of life is always pathological, most often due to hemolysis from blood group incompatibility. Question 106. A patient with history of alcohol abuse presents with confusion, ataxia, and ophthalmoplegia. This triad suggests: A. Korsakoff's psychosis. B. Wernicke's encephalopathy. C. Delirium tremens. D. Hepatic encephalopathy. Answer: B. Wernicke's encephalopathy. Explanation: Wernicke's encephalopathy results from thiamine deficiency, common in alcoholics. Urgent thiamine administration is required to prevent irreversible damage. Question 107. Which investigation is most sensitive for detecting minimal ascites? A. Physical examination. B. Ultrasound abdomen. C. CT scan abdomen. D. Diagnostic paracentesis. Answer: B. Ultrasound abdomen. Explanation: ultrasound can detect ASCITIC fluid volumes as low as 100 ml, making it more sensitive than physical exam or CT for minimal ascites. Question 108. The most common site of gastric carcinoma is: A. Cardia. B. Fundus. C. Body along lesser curvature. D. Pylorus. Answer: C. Body along lesser curvature. Explanation: gastric cancer most often arises along the lesser curvature of the antrum or body, often associated with intestinal metaplasia from chronic gastritis. Question 109. Which antibiotic is contraindicated in children due to risk of teeth discoloration? A. Amoxicillin. B. Tetracycline. C. Azithromycin. D. Cephalexin. Answer: B. Tetracycline. Explanation: tetracyclines deposit in developing teeth and bones, causing permanent discoloration and enamel hypoplasia in children. Question 110. In nephrotic syndrome, the most common cause of death is A. Infection, B. Renal failure, C. Cardiovascular disease, D. Thromboembolism. Answer: A. Infection. Explanation: loss of immunoglobulins in urine predisposes nephrotic syndrome patients to severe infections, especially with encapsulated organisms. Question 111. Which condition is associated with anticentromere antibodies? A. Diffuse systemic sclerosis, B. Limited cutaneous systemic sclerosis, C. Systemic lupus erythematosus, D. Mixed connective tissue disease. Answer: B. Limited cutaneous systemic sclerosis. Explanation: anticentromere antibodies are strongly associated with crest variant of limited systemic sclerosis. Question 112. Which is the most common cause of acute pancreatitis? A. Alcohol abuse, B. Hypertriglyceridemia, C. Gallstones, D. Drugs. Answer: C. Gallstones. Explanation: gallstones cause obstruction of the pancreatic duct, leading to enzyme activation and pancreatitis. Alcohol is the second most common cause. Question 113. A patient with sudden onset chest pain, Saint elevation in leads E, and AVF likely has A. Anterior wall me, B. Lateral wall me, C. Inferior wall me, D. Posterior wall me. Answer: C. Inferior wall me. Explanation: Saint elevation in leads E, and AVF indicates infarction in the inferior wall supplied by the right coronary artery. Question 114. Which is the antidote for cyanide poisoning? A. Atropine, B. Sodium nitrite and sodium thiosulfate, C. N-acetylcysteine, D. Naloxone. Answer: B. Sodium nitrite and sodium thiosulfate. Explanation: sodium nitrite induces methemoglobinemia which binds cyanide, and sodium thiosulfate enhances conversion to thiocyanate for renal excretion. Question 115. In megaloblastic anemia, the characteristic change in bone marrow is A. Hypocellularity, B. Hypercellularity with megaloblasts, C. Aplastic changes, D. Myelofibrosis. Answer: B. Hypercellularity with megaloblasts. Explanation: vitamin B barrow or folate deficiency leads to ineffective erythropoiesis with hypercellular marrow containing large megaloblastic cells. Question 116. Which hormone is measured for diagnosis of acromegaly? A. Growth hormone random level, B. IgA FAC, C. Prolactin, D. ACTH. Answer: B. IgA FAC. Explanation: IgA FAC levels are more stable than GH and reflect integrated GH secretion, making them the preferred diagnostic marker for acromegaly. Question 117. A child with recurrent cinepulmonary infections and situs inversus most likely has A. Cystic fibrosis, B. Cartagener syndrome, C. Primary ciliary dyskinesia without situs inversus, D. Alpha-1 antitrypsin deficiency. Answer: B. Cartagener syndrome. Explanation: Cartagener syndrome is a triad of situs inversus, chronic sinusitis, and bronchiectasis due to defective dynein arms in cilia. Question 118. Which is the gold standard investigation for diagnosis of pulmonary embolism? A. D-dimer, B. CT pulmonary angiography, C. Ventilation perfusion scan, D. Pulmonary arteriography. Answer: D. Pulmonary arteriography. Explanation: pulmonary arteriography is the gold standard for diagnosing pulmonary embolism, though CT pulmonary angiography is more commonly used due to availability. Question 119. In dengue fever, the tourniquet test detects A. Capillary fragility, B. Platelet function defect, C. Coagulation factor deficiency, D. Hemolysis. Answer A. Capillary fragility. Explanation: the tourniquet test in dengue demonstrates capillary fragility and thrombocytopenia, with appearance of petechiae after cuff inflation. Question 120. The most common type of esophageal cancer worldwide is A. Adenocarcinoma, B. Squamous cell carcinoma, C. Small cell carcinoma, D. Lymphoma. Answer B. Squamous cell carcinoma. Explanation: squamous cell carcinoma is more prevalent globally, especially in Asia and Africa, whereas adenocarcinoma predominates in Western countries. Question 121. Which is the first-line drug for absence seizures? A. Phenytoin, B. Ethosuximide, C. Valproic acid, D. Carbamazepine. Answer B. Ethosuximide. Explanation: ethosuximide blocks T-type calcium channels in thalamic neurons, effectively controlling absence seizures. Question 122. Which electrolyte abnormality is most characteristic of tumor lysis syndrome? A. Hyperkalemia, B. Hypophosphatemia, C. Hyperuricemia, D. Hypernatremia. Answer C. Hyperuricemia. Explanation: tumor lysis syndrome causes massive release of nucleic acids, leading to hyperuricemia, along with hyperkalemia, hypophosphatemia, and hypocalcemia. Question 123. In acute rheumatic fever, Sydenham's career is A. A late manifestation, B. An early manifestation, C. A minor criterion, D. Non-specific finding. Answer A. A late manifestation. Explanation: Sydenham's career typically appears months after streptococcal infection, unlike other acute manifestations of rheumatic fever. Question 124. Which is the most common cause of bronchiolitis in infants? A. Influenza virus, B. Respiratory syncytial virus, C. Adenovirus, D. Parainfluenza virus. Answer B. Respiratory syncytial virus. Explanation: RSV is the leading cause of bronchiolitis and pneumonia in children under 1 year of age. Question 125. Which drug is used for medical management of acromegaly when surgery is not possible? A. Octreotide, B. Bromocriptine, C. Cabagaline, D. Pegvisomant. Answer A. Octreotide. Explanation: octreotide, a somatostatin analog, suppresses GH secretion and is effective for medical management of acromegaly when surgery is contraindicated.